So I am going to talk to you, I think it's really interesting what we've heard this morning. So we've heard about this kind of policy research interface and change at European level. Paul has now spoken to us about what has happened at national level with the Citizens' Assembly. And one thing I would like to do before we go to coffee is, as I mentioned that I am between you and your refreshments, is that I have spent, I think, a long time thinking about how does change happen. So what I've done with this presentation is just, thank you, I don't know if I'm too short or too tall, which is to put together, I suppose, some thinking around how does change happen when we're not working at national level. If we're a practitioner, if we're directing an organization, if we're working with people on a daily basis, if we have lived experience, how can we think about how we can be enacting change? I always loved this quote from Shane Butler. I know it's 15 years old, and I know perhaps our attitude to policy change in Ireland has changed a lot. But it makes me think about, well, how has that process occurred that we have moved away from this kind of slow and gradual and ambiguous nature of policy change to maybe something more direct and open in the Irish context. So, I'm pressing the wrong buttons. What I have put together is 3 examples. So I am looking at 3 pieces of work that I've been reflecting on. How did change happen and what change happened? And what could we learn from that about what were the key pieces? One is the domestic violence and substance use and how women's refuge changed, what they were doing. The second one is perhaps more regional or national, and it's to do with the Box and Clever programme. And then I've been doing some work with Iceland, and that's been interesting and challenging, and I'm going to tell you a little bit about that, but very quickly. So the first one I wanted to talk to you about, and I have actually included details of these agencies and what they actually do, because I wanted to ground us back in the work that everybody is involved in. So this is a domestic violence service. They're based in Clonmel, a fairly, dare I say it, if anyone's from Clonmel, I apologise, innocuous regional town. And they had a board of management who had a moment of madness and bought an old bed and breakfast in the middle of Clonmel town. So they went with it and they converted that to a refuge. And it provides self-contained refuge accommodation and all of these other supports. And they do ask me every time I talk about them to mention that they have 10.4 full-time equivalent staff. So they're not a huge organization. But over this kind of number of years, they've really thought about how to start to work with domestic violence and substance use. I'm getting good at coordinating my buttons now. So why did they think about changing? So they had an ongoing presentation of women with dual issues of substance use and domestic violence. They were refusing accommodation for women who were actively using substances, which is very common amongst refuge and some homeless services. They had this collaborative approach with women that they had embedded in their service, and they were feeling really conflicted as practitioners and as an organisation, because women were presenting with, or they felt there were these issues of substance use, of sex working, of sexual exploitation, and trauma around histories of substance use that weren't getting talked about or that they couldn't address. They had also noted that there was a huge change in their context of which they were working. So there was a very different availability of substances that had hit even a town like Clonmel. So this is a quick synopsis of how they approached their change. They went and they did this on a 3-stage approach, or 3 different levels. They looked at their organizational policy, so they needed to actually change what they had in writing. They looked at their practice, and they looked at the presenting issues. And they based all of this on this collaborative relationship with women and thinking about the dual needs of her and her children if she had them. So it was a complicated piece of work. Key for them was putting in writing that they were not now going to accommodate women who were actively using substances. And they started to ask routine screening questions, which was so simple. Some of the women that I've worked with have used drugs and alcohol as a way to cope with their experiences of domestic violence. can you relate to this, or is this something that you would like to talk about? They worked on this for a number of years, and I suppose those are the aspects of what they did. And I think it's useful in terms of thinking, well, how do we actually go about changing? And one of the things that we learned from doing this work is that they couldn't do one of these. They needed to do all three. So they needed to be monitoring the presenting issues that women were coming in with. They needed to be thinking about their practice, but they also needed to change policy. What happened next is interesting, and this is their kind of learning points. And I suppose what's happened in this agency really throws down the gauntlet for us, because they achieved this change with very, very limited resources. They're one of the few domestic violence services, not only in Ireland, but what we now know from the EU Gender Handbook work in Europe, that actually that will accommodate women in self-contained units who are actively using substances. They did this with next to no resources. They did highlight this importance of really good training and leadership within the organization, and they started to get really courageous and start talking to their staff about some of the unspeakable things, the fear about shifting their practice and their work. And that was a complicated process for them. And of course, not surprisingly, some of the resistance in staff team was actually related to people's family experiences of substance use, and also living in a not very large town. There's all of those issues about what will happen if I'm seen to work in a service that's no longer about this, but also about this and this. They started having really open conversations with clients that I was talking about that question. And it was interesting for them because they were then doing an outreach clinic in the substance misuse service. So they were doing these training swaps and they were doing outreach swaps. And one of the staff encountered 3 women in the needle exchange who had stayed in the refuge in the last couple of months. And for her, that was a real motivator, because she never knew those women were using substances. So it was such a learning point that even quite far down their journey, they realized there was such invisibility with the women that they had worked with. They started to be fearless, and they started to challenge the silo approach and be advocates for the women. And they started to acknowledge that, very often the most complex cases will make you quite unpopular with some other agencies when you start advocating for their needs and the needs of their children. They did embed skills transfer, and they really worked with their allies. They had an amazing substance use coordinator in the HSE, and that really was key for them in terms of their change. And then the reactions from the women themselves sustained them. What is important in our talk about, well, how does this happen and what's the interface, is that the research and the publications followed the change in practice. So I think at present they've published 2 articles around their changes in their practice around substance misuse. They've gone on and done another project around adverse childhood experiences, and they've published 3 articles on that in the academic literature. And the 3rd of those articles on trauma and adverse childhood experiences was actually involved all of the practitioners who wrote narratives about that. I'm going to move, because I know we're moving with time, and talk to you about Boxing Clever. The reason why I'm coming back to this, and as someone who has been doing this work for quite a few years, I don't know if this happens to other people, but one gets involved in projects and there's a really interesting piece of research, and then you might be on to the next one and the next one. And I had this moment, I was interviewing a woman for a piece of research I've just completed, and she talked about her involvement in Boxing Clever program in a locality that I didn't know it was happening. And it just made me think, oh my goodness, what happened? Because we did this research in 2014-15, and here now it really made me think about the potential impact of doing research on a program that was within the community many years later. So people will be perhaps aware of the Boxing Clever program, and there's lots of people here who have both initiated it and maybe running versions of it in different parts of the country. But it's an integrated educational substance use recovery and fitness program. What we did in terms of the research was looked at the impacts and the outcomes at individual, kind of social, family, and community level. I again left this kind of information in that's very much about the findings of the research, because I started to wonder when I looked at this, was there something important about the intervention that has made it, I suppose, be duplicated across in different locations? Because we've all worked with projects and interventions that we've felt have been really impactful for those that have participated in them, but why do some of those get replicated in other settings and some don't? So I started to wonder when I was thinking about this, is it because it works at these 4 different levels, that individual, the interpersonal, the social, and the community level? And I think the important other thing that, those that had run the Boxing Clever originally at Ballymun Youth Action Project always talked about embodying the ideals of the athlete and the student. So I think there's something in this program that talks to us about that's what I could be, that perhaps hasn't happened in the Cuansara project. So when I had this moment when I was interviewing for this other research, I went back and had a little look, and apologies if there's anyone in the room that I have missed from my quick search. But since we did this research quite a few years ago, it obviously continues to run in Ballymun Youth Action Project, but I now find it in Limerick, in Cork, in the Midlands, and across a range of locations in wider Dublin. And it had both HSE and Sport Ireland support. It does appear that it has been amended and developed to suit local populations. I also found it in different forums saying coal mine, so I was tripping over it once I started looking for it again. Just on a very, very personal level, I was thinking through from our community drugs program in UCD, and I thought, oh my goodness, there's actually 4 participants who had done the program in Ballymun who have now actually completed the diploma in community drug and alcohol work in UCD. So there's that very personal impact. So hold your thoughts on why that may or may not have worked. What I'm just going to flag for you again is there was research publications. I think we had 3 publications, 2 or 3 from this research. We also published a grey literature report. We did a policy briefing. We made a film in a moment of madness. I didn't put the YouTube link up because I can't look at it. If you want to go and look at it on YouTube, go for it. Somebody commented, was that a long time ago? You look very young. And this was pre-filters, I might add. So this does really make us think about what's the evidence that we're looking to provide, what's the applicability, and how is that resourced? And maybe this is the difference between Cuansara and Boxing Clever. Is there something about the applicability, or is it the nature of the issue? I'm going to finish up by talking about Iceland, and maybe I'm going to destroy some of your fantasies about Iceland, because I know we talk about alcohol and prevention and young people. I have a slightly different take on Iceland. So I got approached a number of years ago, would I come and speak at a conference in Iceland on gender and drug policy? And there's an NGO called Routine, and that's not my best Icelandic accent, who have been looking to have policy change in Iceland around gender and substance misuse. And it's been very interesting. They have basically a long-standing treatment centre that's the Minnesota model. Their drug strategy ended in 2020 and hasn't been renewed. They do have a mixed gender detox and treatment. And they have some NGO and health-led services around harm reduction, including needle exchange and some low-threshold responses. And they've had 2 major conferences, one in 2019 and one just a few weeks ago in 2023. Anyone who had to put up with me will know I got stuck in Iceland when I was there in October, and it was not one of those, let's go to the Blue Lagoon and look at the lovely landscape. It was more of a, someone please get me a plane out of here. So what has been really interesting for me, and I have been to Iceland at lovely times of the year where it was much more pleasant, is where we got to when we were talking about, sorry, I forgot to move the slides on, when we were discussing this. So I ended up having a meeting. I was requested, I met the Minister for Health. I was requested on both occasions would I go and meet with the Health Ministry about how they could move on and change their drug policy. And I was really good. When I was actually in the second meeting, I didn't say, my goodness, I am in the same building, in the same room, with 2 out of the 3 same people, and we seem to be having the same conversation. So it was interesting as I waited to go home, why hasn't change happened? So why has change not happened in Iceland around both their drug policy and their gender element of drug policy? So when we were at the second conference, these were the questions that I put back to them that sounded so simplistic, that seemed to be important to them. And I said, stop a minute. What are the drugs that are being used in Iceland? Who is using them? Who is it problematic for? How do we know? What responses and interventions do we need here? And how would we know that those are working? Okay. And I thought those were actually quite good questions that we could all be asking ourselves in our work, because I think very often we get caught into our organizational structure, we get caught into the programs or what we're resourced to do, and we don't actually ask these questions. We had a discussion, and this was the outcomes of that discussion. And those attending the conference were committed to change, and the ministry are committed to change, but it just is not quite happening. And I'm going to conclude on that in a minute. One of the things that we discussed is, what do they need? They need the Health Research Board is what they need. No, they need prevalence data. They need treatment and intervention data. They need a government-led substance use strategy, and they need integration with their mental health strategy, because they do have a current mental health strategy. And we had a really interesting conversation about what happens when you have a substance misuse or a drug and alcohol strategy. And my argument was, it gives you something to work with, and it gives you something to work against. And the absence of having one means that everybody is in a void. So I didn't figure out on the plane home or while I was waiting endlessly in the airport what might change this, but here was some final kind of thinking about these kind of 3 examples, and a lovely photograph of the Iceland that I didn't get to see. Change can be practice-driven or research-driven. But I think what we see in these examples is that the practice-research interface can be key. And what is the difference between Box and Clever and what's happened in Kunsair? So we have one domestic violence service who's done all this work, 5 or 6 publications, lots of, they've spoken at conferences. They went to Iceland as well and talked to some of their policymakers. And yet there's been very little change nationally around that particular issue, around other domestic violence services. When we look at Box and Clever, there was research, it was research-driven and practice-embedded, and we see perhaps much more positive change around how we think about the different forms of recovery capital and how they can be implemented locally, regionally, nationally. We know that progress is often gradual, and it requires drivers. So we need individuals, we need organizations, we need funders, we need people with lived experience, and they may need to be very tenacious. In all of the examples, when I thought about it, I thought there was always key individuals or an organizational role that drove change. And then my final conclusion, that was policy change in a strategy vacuum is extremely challenging. So that was my only message that I was left with for Iceland, but it made me appreciate Ireland. Thank you very much.